My first question to you, I'd like to know, with the decline of cases and the decline of deaths that we're seeing in the nation, does that mean we are getting out of danger, or what does that indicate?
It certainly is a very encouraging sign that coronavirus cases and the severity is declining across the nation. And I do strongly believe that it's because of the effects of mass vaccinations. At this point, 50% of United States citizens have had at least one dose, which is very encouraging. And if we continue this pace, we certainly hope that we are seeing the light at the end of this tunnel.
Right. And states across the country, even New York and New Jersey, are reopening, doctor. They are reopening restaurants, businesses at full capacity. Some don't even, have the mask rules anymore. Do you think it's a little too early, or people just have to get used to it?
I certainly am a little concerned about the pace in which we quickly opened, especially the arenas, which are full capacity and all. Next few weeks will tell us whether we rushed into it a little too soon. And then do we have to scale back our enthusiasm? I completely understand that people are having COVID fatigue and the pandemic fatigue. So it's understandable that for a variety of reasons, officials want to open it up to full capacity. Whether or not it's going to be a bit too early, too soon, and too much, time will tell. If we look at it a different way, it's also an incentive for people to get vaccinated, because then these are the things people can do. Like, if you get vaccinated, then you can go to sport events, you can go to concerts. So that's an indirect way to incentivize people. And I hope it works that way.
Right. But there has been a prediction, doctor, of a possible surge in the South because lack of vaccinations and also the opening of everything. If that causes a surge, what happens to the rest of the nation, especially states like New York, New Jersey?
It's definitely a big concern because, as you know, a lot of southern states, the vaccination rate is not good. There is significant vaccine hesitancy. So if you look, some certain southern states such as Alabama, Mississippi, they are lagging behind quite a bit. However, they did open completely. And because of summer and because of travel, there is going to be a lot of traveling back and forth from those states to the northern states. And that poses a serious concern about another additional surge here.
Right. So what do you think needs to be done right now?
I think the government should make a very concerted effort with whatever religious, social institutions it can get help from to promote vaccinations. Because now there is no shortage of vaccine. Anyone who desires to get a vaccine can get it. It's easily, widely available. So access is not an issue. Hesitancy becomes an issue. Sometimes mistrust in government for various reasons and historical reasons, it does become an issue, especially in communities of color. That has traditionally been an issue. So if we can get help in those areas, those sectors, it will go a long way to help us get over this barrier.
Right. And doctor, when you're looking at this community of anti-vaxxers, there are some people who have not gotten any vaccine. They just don't believe in it. And it's really hard even for the government right now to get those people inoculated. What will be the result if the anti-vaxxers continue to not get vaccinated and we have that portion of the community that is at high risk?
As a person of science and as a person who has spent most of her career in medicine, I would urge people to listen to science. It has shown benefits, it has shown results. Get vaccinated. And because there you can appeal, but if the you can appeal to the mind, but if the vaccine hesitancy is deep rooted, which we have seen time and again,
Yeah.
that people choose not to get their kids vaccinated, uh, I'm not sure if coronavirus can break that barrier. But that does pose a concern because that will be a step backwards for us in achieving herd immunity. And also, as you know, the virus has more likelihood of mutating when it jumps from one host to another.
Yeah, and these variants of the coronavirus are always
Mhm.
worrying me and everybody because you just don't know how dangerous it could be and if the vaccine is effective against it. Just talking about children that you just mentioned, many parents across the country are, some are inoculating their children between the ages of, 12 to 17. And some are really worried about the effects of this vaccine on their growing children, on the development. What do you have to say to these parents? And what is the impact of this vaccine in that age group?
We are seeing now that a lot of adults are vaccinated, we are seeing a surge in hospital patients, especially even in ICU, of teenagers and young adults because they are not vaccinated. And the barriers have been down now and people are mingling. I would suggest considering seriously getting your kids vaccinated so can they can go back to being children.
Right. And meanwhile, doctor, there is also trials going on for age 5 to 11. How are you looking at that? And, do you think they need the same kind of dose? How would that be different? And that's a really big developmental age. How will that impact the child?
That's why there are one rule in medicine, Aditi, is always do no harm. Right, and vaccines are big in that. That do no harm is the first tenet you should go by, and that is very applicable to this age group that you have said and pregnant women. And that's why those categories are left to the very end to try it out because the safety and as well as efficacy and more safety here has to be tested out in all the populations. And then this special subgroup gets tested. So I think the jury is going to be out on that for a long time now.
And now when you're looking at children, there's a lot of confusion regarding how to return back to the fall. Should they have, should they require students to be vaccinated in a certain age group? Should the mask be allowed, which some states are taking that restriction off? New York City is keeping it. I believe the state is keeping that restriction. Many are saying that 3 feet of social distancing distance is enough. We don't need 6 feet. I'd like to know, how are you looking at this entire situation? And, what piece of advice do you then give to the parents who are really worried about how to send their kids back to school?
First and foremost, my suggestion, and my heart goes out to the parents of young children who, for the first year, had to keep their kids at school, keep their kids at home, teach them from home. I have seen many young women, many young men and women struggling with that, and it was not an easy feat. So everyone wants the kids to go back to school, first of all, for them to get this right social experience, from them to learn, because learning just doesn't come from books. It comes from your peers. And for them, the first and foremost, my suggestion would be seriously consider getting your kids vaccinated. And if you choose not to, then please put masks. I think keeping the kids masked would be a great idea to prevent them or protect them from this deadly virus.
Right. How are you looking at how lenient people are looking at the mask right now? What does that make you feel when you're seeing more and more people maskless?
Oh my gosh, it's such a stark, change of what we were used to for a year. So if I see someone with mask, or if I step out and I don't wear a mask, it has become the new normal for us.
Right.
So I certainly hope that we have opened up, and I understand that, but I think people should still be careful.
Yes.
In planes, in any crowded places, any public places, consider wearing a mask, because I still believe, I have this uneasy feeling in me that we may have another surge coming up when the temperature cools down, or when there is too much mingling during summer months and the beaches are crowded and the concerts are going on at full capacity and people are meeting and greeting. We may see another surge, and a mask, we know that masks protect us.
Right, but we also saw a surge last year in the fall when summer was okay for us, and then it went to the fall and we saw surges everywhere. Do you see the same kind of surge happening, or would it be less because of the vaccinations this year?
I certainly hope and expect it to be less, just because 50% of the population is vaccinated now. People also know washing, hand hygiene has been much, much better than what we had known. But vaccination, hand hygiene, and if people use appropriate precautions of masking themselves when they're in too close community and with people of unknown vaccination status, I think there will be a surge, but hopefully it's much milder.
And talking more about vaccines, Dr. Moderna has applied for a full FDA approval. They have also applied for emergency approval for children aged 12 to 17. What does it mean to have a full FDA approval? How does that change how we're looking at vaccines?
Then when Moderna gets a full non-emergency FDA approval, that means Moderna now comes in the same category as any other vaccination, like a flu shot. And that's how it will change. Sometimes it can be just the perception, because a lot of times some parents and some adults are thinking, oh, it's still experimental. And if Moderna gets that full approval, then that might cut down on the hesitancy a little bit.
Right. President Joe Biden has set this goal of having 70% of the nation vaccinated, at least with one dose, by July 4th. Do you see that happening? And how do you think these celebrations, which are usually massive in the country, be handled this year?
This is a steep goal, because we are certainly several significant points away from that 70% mark. And we have 3 weeks remaining now. So it certainly is a steep goal, attainable if we make a concerted effort, especially in the southern states. Barring that, then because you need 70 to 75% of people to be vaccinated to get some sort of herd immunity. And if we don't get that, then I do have concerns about the 4th of July celebrations across the country. And I hope that that's not the big spreader event for the weeks to come.
What's your doctor prediction for the next 3 months?
I think everyone is going to be out and about during summer. And then we may see a surge in the fall. I hope it's not as bad. I don't think it will be. But I do see this opening up might have its effects. I'll be very happy to be wrong, Aditi, but those are the concerns, just knowing how things transmit.
Yeah, but it's important to know this prediction so that people can prepare for it and again protect themselves. It's all about protecting against this virus. I just have a few questions left here for you on India and what's happening there. How are you looking at the surge? And today, the state of Bihar in India reported over 9,000 deaths in this state, even though the former tally was about 5,000. There's this whole conversation about having the deaths and the cases number 5 times worse than what's being shown in official figures. What's your comment on that, and how are you observing the numbers there currently?
I am very saddened by the state of affairs in India and in Bihar, because overall, India has reported 6,000 deaths, and then some states like Bihar are even higher. And my heart goes out to them, just because first there was an issue with getting the vaccine. Fortunately, now there is vaccine hesitancy, and then there is vaccine availability. And I hope that I was very delighted to see that President Biden has made a commitment of sending a very large shipment to India of the vaccine doses. So there, and other countries are stepping in. We are a global community now, and all the other countries are stepping in to do that as well. That hopefully will cut down on the availability issue. There are also vaccine productions going on in India, where hard work and ingenuity, I will rephrase it, where hard work and entrepreneurship is at its best. So I have no doubt that India will step up as well. So vaccine availability hopefully should be on a decline. Vaccine hesitancy is another issue, and I think government is making an effort, and we should continue to do that. Another disturbing news that I read about the vaccination in India is that women in India are significantly lagging behind in getting vaccinated. And I hope that the government had done a great job a few years ago, Aditi, if you have ever seen it. Beti Bachao, Beti Padhao.
Right.
In that segment, the government had done beautiful PR in that space. And I hope they take help of celebrities and public figures and encourage vaccination. Actually, I'll say I'm part of Akshay Patra, which does remarkable work in giving giving food and promoting education for children as well as girls. And we are going to now tie that with promoting vaccination for the families.
Oh, wow. So it's a push to vaccinate the most underserved communities who do not even know the importance of getting that. That's really interesting. What do you think is the biggest issue lacking in India's healthcare system even now? What is the biggest problem?
Access is the biggest problem, availability, and sometimes mistrust.
Right. That makes sense. And what is your now prediction for India, doctor? How are you looking at that?
Situation in India is grim, and I hope it gets better. Vaccination is the key, because the density of population poses a significant problem for India. India has done amazingly well with smallpox vaccinations, malaria prevention, and I have no doubt that India will do well with COVID also, when all the forces go behind getting the population vaccinated. And they can make incentive-based programs, which is what we are looking at, to get people vaccinated, and that's the way to overcome this huge obstacle.
Right.
Because if COVID continues, it has affected India's economy significantly. And all the progress and amazing progress that India has made over all these years, it just pulls it back so much. And I hope we can overcome this obstacle quickly.
Yeah, I hope so too. India is such a large nation. We can't let so many things go down with it. It's just not possible. My last question to you, doctor, there's been a prediction for India to have a third surge this year. possibly around the fall time. How are you looking at that? How dangerous could it be? And I don't believe they have enough time to vaccinate a majority of the nation by then because of the population. So, how should it be handled?
It's a very difficult question because the population poses such a huge risk for ongoing spread of the virus, and more importantly, the mutations of the virus. So, speedy vaccination, incentive based vaccination is the way to overcome this, in my humble opinion.
Yeah, so important. The lesson learned today, get vaccinated wherever you are because we need to defeat this crisis.
Correct.
Dr. Kulkarni, thank you so much for your time here on ITV Gold.
Absolutely. Can I add something else here, Aditi? You
Of
can
course.
put it in wherever. India has done such an amazing job with vaccinations. I remember the time and days when people that I knew in my community, my family, had smallpox, and that left so much disease and disability and disfiguration. And India overcame that by vaccination and mass vaccination. So I think incentive based vaccination can help us turn this tide as well.